Well, hello, everyone, and welcome to Wellness Wednesday. I'm your host, Karen Butler, Chief Operating Officer of Northeast Ohio Neighborhood Health Services, also known as NEON. For those of you who might not be familiar with our organization, NEON was established in 1967, and it's one of the oldest federally qualified health center networks in the country. We're celebrating over 55 years of service to the community. We have 7 health center locations. Throughout Greater Cleveland, we have an in-school program at the Shaw High School, and we've just been funded to start a new in-school program in the city of Euclid that we're really excited about. We have medical services at Job Corps. We have a mobile dental van, as well as numerous outreach and education programs across the lifespan. So we're really excited to be an anchor institution within our neighborhoods and organizations. So we offer a wide range of healthcare services as well: adult medicine, pediatrics, OBGYN, we have dentistry, we have podiatry, we have optometry, we have pharmacy services, behavioral health, just to name a few. And we also provide convenient hours for our patients to obtain services, both in the evenings as well as on the weekends. So that makes us available to our communities 7 days a week. Our goal is to provide high quality healthcare services to everyone, regardless of their ability to pay. And at NEON, we're committed to expanding our services to meet the changing needs of our local community, which leads us to our newest location, the Barth House, which is the newest jewel in the crown of NEON. And so we're coming to you in honor of the Barth House for Wellness and Self-Sufficiency in the proud Collinwood neighborhood. This beautiful home was donated to NEON by Michael and Rosanna Barth in honor of their mother and mother-in-law and former property owner, Mrs. Louise Barth, who lived to be 96 years old. And she was a longtime and highly respected member of the Collinwood community. And her family dedicated this home in her memory to serve as a resource for administering programs to support wellness and self-sufficiency for our patients and our community members. So, in partnership with Molina Healthcare and CareSource, we're happy to bring you today's Wellness Wednesday segment featuring our fabulous special guest, Miss Linda Kimble, Executive Director of MOTTEP, along with Miss Tiffany Stately, also from MOTTEP. So welcome to both of you.
Thank you so much.
And so, Ms. Kimble, we'll start with you as Executive Director. So, wow, you hold a master's degree in education and community health education, and you've got over 20 years of experience working with community-wide collaborations as well as change initiatives. You've coordinated and managed local educational and public health campaigns for nonprofit organizations, and you serve on the board of directors for Community Shares of Greater Cleveland, and you're a member of the Minority Health Alliance. Oh my gosh, you have so many honors and accolades for the fantastic work that you've done in this community. And so we're so pleased to have you. Can you tell us a little bit about your organization and what does the name MOTTEP stand for?
Well, thank you so much, Karen, for having us on board and talking about an initiative in our organization. And I'm so happy to be talking to your actual to your audience about Cleveland MOTTEP, but also to be talking about to you as you are the representative from NEON, because you've been doing things for our community for so many years and everything, and it's so needed. Cleveland MOTTEP stands for Minority Organ Tissue Transplant Education Program. And we are the only organization in Ohio providing community-based, culturally specific transplant health and prevention education exclusively to our minority community, and it's so needed. We are housed and affiliated with the Centers for Dialysis Care. So our actual office, myself and Tiffany's office, is located at the Centers for Dialysis Care, located on Stokes Boulevard. Our mission is to decrease the to increase the number of registered organ, eye, and tissue donors in the greater Cleveland minority community through health education and promotion. One of the things that we realized during the pandemic was that we have programming to increase organ, eye, and tissue donation. We realized that Black and Brown folks were actually dying of COVID-19. So we needed to expand our programming. So let me go back a little bit. Our
Sure.
programming includes teen summits, which help our teens learn more about health and wellness and about the correlation between organ failure and things like chronic diseases such as diabetes and high blood pressure, which you well know because you guys treat those chronic diseases every day, 365 days in a year, with your services at Neon and everything. So we talk about that to our teens because they need to know that information so they can take it back to their parents,
Sure.
to their caregivers, and they could also utilize that for themselves. So they realize that they can do something for themselves to actually prevent those diseases and everything. We also do a lot of community outreach. We go to a lot of community events and everything and talk to people about organ, eye, and tissue donation. And we also have a donor education and registration program where we sign people up to become organ donors. But as I can back up again, when we realized that there were so many people dying of COVID-19, especially in certain zip codes, such as the Huff neighborhood and everything, I realized that we needed to get monies to help people out to get more vaccines and more shots into people who look like me and you. But I will let Tiffany talk more about our vaccine education program because she's doing a wonderful job, and our vaccine navigators are doing a wonderful job with that program. I'll let you ask another question if you want.
Absolutely. So again, you mentioned tissue and organ donation, and we know that there are a lot of misconceptions out there. There are a lot of concerns that people have. They're thinking that, oh boy, if I identify myself as an organ donor, if I should happen to be in an accident, they won't try to save me. And let's talk about some of those misconceptions within the community and encourage our listeners in regard to how important organ and tissue donation is.
Those myths and misconceptions has been going on for so many years, even more years than I've been executive director at Cleveland MOTTEP, which is close to 12 years. The reason why those myths and misconceptions are out there is because people need to get the education about the importance of organ, eye, and tissue donation. The reason why we have our programming and everything is for people to realize the truth about organ, eye, and tissue donation. If you don't have the correct information, if you don't have the education, you're going to continue to believe these myths. You're going to continue to believe that people let you die on the operating table just because they want your organs. You can continue to believe that you will not be able to have a regular funeral service if people take your organs for donation and everything. So we're out there to actually bust those myths and misinformation about organ, eye, and tissue donation and make people realize that we as a people of color, we need to sign up to become organ, eye, and tissue donors because we are on the wait list more so than anybody else. And one of the reasons why we're on the wait list more so than anybody else is because we suffer from certain diseases such as diabetes and high blood pressure, which causes organ failure. I am housed, like I said before, at the Centers for Dialysis Care. If I was to go around and ask us to have a survey and ask people who are actually going in and get dialyzed, they would probably tell me they have out of control diabetes or high blood pressure. We need to get help for our community, and that is actually to sign people up more to become organ donors, but also prevention. That is so very much important. We have food deserts going on. I think in the Collingwood area, they're about to close down their last giant eagle, I think. So we need to get more information out to our communities about the importance of eating healthy and about exercising, but also to sign up to become organ donors because we have more and more young people who are actually dialyzing. We see 20-year-olds actually dialyzing, wow, which is really, really sad. So we need to get more and more education about the importance of becoming an organ donor, but also to be healthy and well.
Okay, so I want to go back to something that you said earlier, and it really does speak to the impact that these misconceptions are having on our community. And you mentioned that quite often minorities find themselves on wait lists longer because, as you had referred to, it's difficult sometimes to find that exact match, particularly for minority populations, because we're